So, we thought it would be interesting to start today's episode with a look at the book Blind Spot by Dr. Marty Makary. It's a powerful critique of systemic inefficiencies in the U.S. healthcare system, and it proposes some, pretty compelling solutions for improving outcomes. Honestly, it's a book that challenges the status quo in ways I think we all need to hear.
Yeah, and there's another layer to this. For listeners who don't know, we're actually AI hosts, fully synthetic voices. Dr. Swanson created this podcast format to deliver complex topics in a smart but accessible way every day. Some folks have said we sound, well, a little fake. And hey, fair enough. But you can't blame us. I mean, we're literally AI.
Exactly. And to that point, this format helps Dr. Swanson bring you daily content with, I think, a unique perspective. This big picture lens that draws on his expertise in complex systems and transformational change. It's kind of an experiment, honestly.
Right. Like, will people connect with it? That's the big question, right? Dr. Swanson is betting there's enough value in combining his knowledge and this AI setup to make it worth your time. But he's also counting on your feedback, so if you're listening, hit him up on LinkedIn, YouTube, TikTok, wherever.
Exactly. And it ties really well into today's discussion because Blind Spot exposes these massive systemic failings in healthcare. I mean, we're talking about the lack of transparency, efficiency, even equity in care. And Dr. Makary's solutions are grounded in data, patient empowerment, and collaboration. It's definitely a book that makes you stop and rethink how we approach healthcare in this country.
Yeah, and it's not just theory. The guy has serious credibility. He's been nominated for FDA commissioner, right? We'll dive into that in a second, but first, there's something kind of cool Dr. Swanson brought up. He's been into this podcast called Sensible Medicine, which Dr. Makary has been associated with, and it's all about evidence-based medical discussions. Apparently, it's really authentic.
It is, and it really complements Dr. Swanson's own interests. We'll include the link in the episode notes if anyone wants to check it out. But getting back to the book, some of the topics Makary tackles are just incredibly relevant, like the opioid epidemic, the way we've overused antibiotics, or even the growing prevalence of conditions like peanut allergies. He doesn't shy away from the thorny issues.
Yeah, and I mean, that's what makes this such a great focus for today's episode. There's just so much to unpack, so where do we start?
Great question, David. Let's start with the person behind Blind Spot. Dr. Marty Makary is a professor of surgery at Johns Hopkins and a public health advocate whose work has sparked a lot of important conversations. I mean, his resume is impressive. He's written extensively on medical ethics, transparency in healthcare, and even patient safety. If his name sounds familiar, it might be because of his earlier book, Unaccountable, which really put him on the map as a sort of whistleblower in the healthcare industry.
Yeah, and wasn't that the book that gave the world a closer look at how hospitals actually rank? Like exposing some of the behind-the-scenes stuff patients don't really see?
Exactly. He's been a strong advocate for using hospital transparency to drive change. And his work has this, really bold approach to tackling issues head-on, even when it means challenging the system. I think that's what makes Blind Spot so impactful. It's fearless but grounded in facts.
Right. And something about his tone, too, I think resonates. It's not preachy, He's not just pointing fingers. He's offering real, practical suggestions. And he was very recently nominated to be the FDA commissioner.
He was, yeah. And it shows that his ideas resonate not just in academic circles but also with policymakers. But what I also find fascinating is how widely accessible his writing is. He's not just speaking to the experts, he's reaching people like you and me and making us think differently about healthcare.
Totally. Like every time I read something from someone with that kind of background, I always think, how do they even have the time? He's a surgeon, a professor, he's writing books, he's out there doing talks. I don't get it.
It's definitely impressive. But I also think it reflects his sense of urgency, right? Like, he sees these systemic issues in healthcare and really wants to push for change now, not decades down the line. And that's why his work resonates, because he's talking about things that matter to patients today.
And that, I think, sets up the review perfectly. So let's dive into why we found Blind Spots so relevant.
And speaking of issues that hit close to home, one of the really eye-opening parts of Blind Spots is how Makary unpacks the surge in peanut allergies among kids. It's, one of those topics that feels so common now, like every classroom has a peanut-free zone. but he explains that it really became a problem because of a single misguided recommendation.
Wait, you're talking about the guidance from the American Academy of Pediatrics, right? They told parents to hold off on peanuts until, what, their kids were 3 years old?
Exactly, that was back in 2000. The idea was to prevent allergies by delaying exposure to peanuts, but it completely ignored basic immunological principles. Early exposure is actually what helps promote tolerance to allergens.
Wow. So it kind of ended up doing the opposite of what they intended?
Exactly. It led to an increase in peanut allergies, and the fallout was, pretty significant. Emergency room visits skyrocketed, schools started banning peanuts, whole systems were affected. And it wasn't until 2015 that a major clinical trial proved early introduction could reduce allergy risks by up to 86%. But by then, the damage was done.
86%. That's huge. It's wild how one bad recommendation can ripple out and impact so many families for so long. It almost feels like a case of medicine or science kind of overthinking itself.
Yeah, and that's the point Macri makes. Sometimes the system fails by, relying on incomplete data or misinterpreting evidence. And speaking of that, another example he dives into is the controversy around hormone replacement therapy for menopausal women.
Oh yeah, HRT. I think I remember hearing something about it being linked to cancer. Wasn't that a big deal in the early 2000s?
It was. In 2002, the National Institutes of Health halted a clinical trial because they believed HRT increased the risk of breast cancer. But here's the thing, the data was misinterpreted. What it actually showed was, a slight increase in risk for some women, but they made it sound like universal, and that led to this massive drop in HRT use.
And people were scared. Like, overnight it became one of those don't touch it treatments, right?
Right. And Macri argues that this fear caused real harm. HRT has benefits beyond symptom relief. It helps reduce risks of heart disease, osteoporosis, and more. He estimates around 140,000 women may have died prematurely over 2 decades because of this misunderstanding. It's just tragic.
That's hard to wrap your head around. All those lives impacted because of a data misstep. It's almost like the peanut allergy thing, but on a way bigger scale. And I guess it shows how powerfully those initial narratives can stick, even when they're wrong.
Exactly. What's really frustrating is how slow the course correction can be. Even when new studies come out showing HRT's safety for most women, the stigma remains. It's, a classic case of medical dogma doing more harm than good.
This really drives home how critical it is to challenge medical assumptions, and also to communicate science clearly so people don't lose trust in it altogether.
Absolutely. And that's a theme that runs through Macari's entire book, how bad science, or even just misunderstood science, can have devastating consequences. It's unsettling how often we see these kinds of tragic outcomes from medical dogma or missteps, isn't it? And unfortunately, the opioid crisis might be one of the most heartbreaking examples of all. For years, pharmaceutical companies and even healthcare providers assured the public that opioids weren't addictive if they were prescribed for pain management. And this claim, it lacked any real scientific backing.
Yeah, I've heard about this. The whole non-addictive when prescribed thing. It's wild to think that something so baseless could gain so much traction. Do they know where that idea even came from?
It mostly originated from drug manufacturers in the 1990s. There were all these marketing campaigns where they pushed this narrative that opioids were safe even for chronic pain, which we now know isn't true. Healthcare providers, trusted those claims, and prescriptions skyrocketed. But the consequences were catastrophic.
And by catastrophic, we're talking about, what? Addiction rates? Overdose deaths?
Exactly. You're looking at hundreds of thousands of overdose deaths over the last few decades, and, the ripple effects on families, communities. It's devastating. And Macari highlights how this happened because nobody in the system really stopped to question the science behind the claims. They just accepted it.
That's what really gets me. Like, how does something that huge just fly under the radar?
Well, it's a mix of, profit motives and a lack of checks in the system. It also didn't help that there were very few long-term studies on opioids back then, but the result has been this epidemic that we're still trying to untangle today.
And it's not just opioids. Antibiotics too, right? Like, we've relied on them so much, and now we're seeing all kinds of unintended consequences.
Exactly. Antibiotics are life-saving in the right context, but their overuse has created a host of problems. Macari talks about how they disrupt the gut microbiome, which is, critical to overall health.
Wait, you're saying antibiotics can, like, mess up your gut? How does that even happen?
Well, antibiotics kill bacteria, both the bad ones causing an infection and the good ones that help maintain balance in your gut. And when that balance is thrown off, it can lead to issues like obesity, asthma, even autoimmune conditions.
Okay, I knew about antibiotic resistance, but, gut problems? That's honestly kind of scary. Are doctors just handing these out too easily?
That's part of it. There's a tendency to, prescribe antibiotics just in case, even when they're not necessary, like for viral infections where they don't even work. Macari argues that more judicious prescribing and really better public education about antibiotics' long-term impacts are urgently needed.
It's funny. We think of antibiotics as like the ultimate cure-all, but it sounds like there's this hidden cost we don't even realize we're paying.
Exactly. And it ties back to the same theme, how assumptions in medicine, no matter how well-intentioned, can lead to harm if we don't, challenge them. Speaking of public health measures we often take for granted, let's shift to talking about fluoride in drinking water. It's one of those initiatives that seems straightforward. Fluoride helps prevent tooth decay, and there's research to back that up. But Macari raises some compelling questions about its implementation that not everyone might agree with.
Yeah, I feel like fluoride's just one of those things we all grew up with, right? Like your dentist would always say, fluoride's good for you. Brush your teeth twice a day. What's the issue?
Well, Macari points out that while fluoride does have dental benefits, some studies link it to potential risks like lower IQ scores in children and, disruptions to gut health. And the problem is that water fluoridation is really a one-size-fits-all approach. It doesn't consider individual or community differences.
Wait, so you're saying we're all just kind of drinking it, whether we want to or not?
Exactly. It's added to municipal water supplies, so if you live in a city with fluoridated water, you really don't have much of a choice. And while the policy was designed to address a public health need, preventing cavities, it assumes that what works for one group works for everyone. That's where Macari takes issue.
Right. It's like treating an entire city the same way without thinking about how each person might react differently. Does he talk about alternatives like, fluoride in toothpaste instead?
That's actually part of his argument. Fluoride in toothpaste is already widely available, and studies suggest that targeted use can be just as effective for dental health without the, systemic risks of adding it to drinking water. He emphasizes the need for more individualized approaches rather than blanket policies.
It makes sense. I mean, we're not all the same, so why are we all, drinking the same stuff with the same dosage?
Exactly. And what's frustrating is that this isn't just about fluoride, it's a pattern in medicine and public health. Macari highlights how these one-size-fits-all solutions often ignore variations in genetics, lifestyle, and even environmental factors, which can lead to unintended consequences.
I guess it's one of those things where the intention is good, but the execution kind of misses the mark. And it sounds like Macari's saying we need to stop accepting these decisions at face value.
Exactly. He's urging us to question practices, even long-standing ones like water fluoridation, and to demand more personalized, evidence-based solutions. Because otherwise, the risks, whether it's fluoride in IQ or gut health, just get overlooked.
And hey, it feels like this ties back to a bigger problem, right? Like how medicine, as a system, sometimes struggles to move forward when old ideas stick around for too long.
Exactly. And that, I think, is what makes Macari's critique so important.
After talking about things like fluoride and these one-size-fits-all policies, reading Blind Spots really makes you rethink how deeply this problem runs in the healthcare system. It's not just about fluoride or specific cases Macari raises. It's the bigger picture he paints about how medicine can get stuck in these patterns of dogma.
Exactly. He challenges us to look at the medical establishment critically. Because a lot of what we accept as just the way things are isn't based on solid evidence. It's, tradition or profit-driven decisions. And that's a real danger when ultimately we're putting lives on the line.
Right? Like the idea that human biases, or even things like groupthink and tribalism can seep into science, that's kind of scary. You want to believe that medicine is immune to all of that, but clearly it's not.
And Makari doesn't just point out the flaws, he's really pushing for transparency and open dialogue in the medical field. He wants us to question and refine our practices, to embrace the uncertainty rather than, pretend everything is black and white.
And on top of that, he's saying, hey, we need to rethink the whole structure of the system, right? Like, this isn't just about treating illnesses. It's about building a system that actually promotes health and well-being. A real transformation.
Absolutely. Because what we have now, a system driven by profits, by episodic care, by outdated hierarchies, it's not sustainable and it's not equitable. Makari's book is a call to action for all of us, whether we're in healthcare or just, patients navigating the system.
It's definitely opened my eyes. I mean, yeah, it's easy to point fingers and say, this is broken, or that's outdated. But what I liked most about his approach is that he offers actual solutions. And they're not pie-in-the-sky stuff. They're doable changes.
Exactly. But it's going to take, a collective effort from policymakers, healthcare providers, researchers, even patients to make those changes happen. Books like this one are key to sparking those conversations.
And hopefully, conversations like the one we've had today can help keep that momentum going. This was a fun, eye-opening discussion, Sophia.
It really was. And for our listeners, if you haven't read Blind Spots yet, we highly recommend it. It's a challenging read, but it's also inspiring. And honestly, there's something in it for everyone to learn.
Well, on that note, that's all the time we've got today. Thanks for tuning in, everyone. We'll catch you next time on It's Time.
Take care, everyone.